Nothing lasts longer or does better for the patient than an implant.
I had an implant placed, and it's now been 15 years since it's been placed. I never had a problem. I clean it just like I clean my regular teeth. I brush it, I floss it, and it's just been a tremendous change to have a dental implant instead of a bridge, and particularly failing bridges.
In my office here, I have my own 3D printer. And because I have the printer here, I can print models for you. So if you send me a set of models, I can take it, I can cut the teeth off, print the teeth, and print the model. Why is that important? Because that means I can put the analogs of the implants in place. And when you have those, you can make your temporary fit that. And you can also mount the model on your articulator so you know where you are. This is also important for the lab so they can make the dentures and the temporary bridge for the implants. So we can do the teeth in an hour. I can also print out bone models on these cases. And why is that important? This allows us to make the bone reduction guide. So I know where the bone's going to be also. And I can also print this with the implant analogs in place so that we can make a bone reduction guide also. And again, because I have a 3D printer here, I print it here for you. This also allows us to have the guide for the reduction. I print guides that can fit on bone, like this one, and I can print guides that fit on the teeth, on the cases where we're doing extractions. I have a bite registration. I leave enough of the teeth on there because I only cut out where I need to go to place the implants. And now I can use the bite registration and keep your vertical dimension correct when we're placing the implants, and I use that bite registration you gave me. It's important to you. Once you've got the denture fitting well, I can use that to make the guides. Once I've made the guides, I can send a set of guides to you so you can pour your model. Why is that important? Well, because you poured your model using this, it's going to save time. It becomes more cost effective. You're able to mount this on the articulator because I didn't cut all the teeth off of it. And because of that, you'll be able to use your bite registration, put this back onto the articulators, and be able to convert either a duplicated denture of the one you currently have, or use the current denture to convert it into your temporary bridge. For the patients, it's very much cost effective because I'm not charging them to make this guide when I'm going to put the implants in. So I put the implants in, generally flapless on these cases where there's no teeth. And then you'll have the positions of where the implants are and be able to make your temporary much more simply.
I would never smile in a photograph. These are my teeth before I started, and I didn't like it because it was like a bulldog.
So we've got these stone models done. We've got the wax up that you've done. I've duplicated it, so now I know where the teeth go. I positioned implants ahead of time, so I know where they're going to be too. I've selected the abutments ahead of time. You can come online with me because I can keep it live online and we can go over this together. So now I've positioned these. I come back and again, like I told you, I can print a model with the soft tissue. This is what you need to mount your cases for your lab work. I need the bone model so I know where the bone's going to be so I can do the bone reduction. For implant surgery, patients should come to a surgeon, an oral surgeon, in order to have the implants placed. There's experience there. There's the knowledge of how bone works, how it can be loaded, where things should sit in order to be cleansable, accessible for the prosthodontics to be done.
When I first went home from the dentist after I had the crowns in and everything was all set, I went home and took a raw carrot and chewed on that side just to make sure that they would in fact chew and work. I mean, it was just amazing.